$7,500 for every man, woman, and child in America for health care, about twice as much as the next most expensive country in the world, which is France. And so when my opponent talks about Obamacare, I like to talk about McCarthy care.
Yeah.
What's his answer? Just don't get sick.
Yeah.
Or just use the emergency room.
Yeah.
You know, that's a big part of the problem.
I think you're missing the message. I think what shocks me is that the Democrats aren't using personal responsibility. The Republicans have always said they're the party of personal responsibility. What they're doing is requiring people to contribute something, because the hospitals in this country are full of people that are indigent.
That's right.
Can't afford care.
That's correct. And so when we look at the cost of health care, we have very short-sighted perspectives. The cost of health care has in fact gone up since the passage of that bill. It hasn't gone up as much as it would have without the passage of that bill. And in the long run, it will save our economy. The last thing in the world we need to do is take away the gains we've made and replace it with what? Just don't let lawyers sue doctors for malpractice, or just allow people to buy insurance across state lines. These are not solutions. It's a very complicated business. I spent a lot of time studying healthcare, and if you did listen to me on the radio, you know that every month we had long programs about healthcare and a couple of town hall meetings about healthcare. Again, I don't claim expertise in this, but I learned a lot about it. And we need to hold together to make sure that we not only keep the gains that we've made, but go further. And somebody asked about a public option. I don't think there should be a public option. I think the public payment system should be the norm, and we should have private options. The way they do in Great Britain. If you want to get insurance, you're welcome to it, but just don't take away what essentially would be Medicare for everybody. Yes, sir.
Will you explain what HSAs are and how widespreadly they're used, and what your position is?
Yeah, you're talking about the health savings accounts?
Yes.
Well, the concept is that you contribute to your own health care, and then when you need the money, it's there and it's taxed. I mean, that's in its simplest form. That's how I understand HSAs to work. I don't know how widespread they are. I don't know how effective they are, and I don't know how useful they are to middle class and lower middle class earners. I think they're fine for people of means, but if you have limited resources, I don't know how much good they do, but maybe you can.
Well, one of the advantages of putting the consumer in charge of his own health care by giving him the option of saving money for health care,
right,
with incentives, tax-free savings account,
right,
is that he will look at the quality of care more carefully and how much it's costing.
yeah.
Right now, when you go to the doctor and insurance is paying or the government's paying it, you don't really get too involved with how much it's going to cost unless you have to divvy up some money.
And I agree with you that there are conceptual benefits to these savings accounts. I just don't know how accessible they are to most people. And unless you earn a certain amount of money, first you won't have the money to put away, and the tax benefit is inconsequential to you. And then secondly, if you have catastrophic illness, depending on the kind of insurance you have, it might not be enough. But conceptually it's good. I just wouldn't want that to be the only option. That's my.
Well, it should be started with people who are much younger than.
Sure, that's exactly right. Because of course, when we're younger, we think we're immortal and who needs insurance. Yes, sir.
Well, one thing, I'm a nurse, and the one thing I think about Medicare is that would employ people is to have more fraud, checking on fraud, because I know if a nursing home charges $100 to put a 2x2 pad on a diabetic sore, that's a little outrageous, and that's why we're going broke. I'm all for health care for everybody, and I think if we would employ more, and as a nurse, we all don't know, we're paying now for the sick and indigent and the poor. We all pay now. So to make other people, like the Obamacare, is to make young people contribute.
Personally responsible.
And when you're young, you don't think you're going to get sick. And especially when you're independently employed, you don't buy your own insurance because it's expensive. But you and I all know the ERs are full. I know I worked in the NICU, $1 million babies that all of us pay. But we don't also know that Medicare charges way too much for what you're doing for
And I've heard a lot of,
a chest
sure.
tubes or.
And I've heard a lot of medical professionals say that we do have to be more vigilant about.
And I've seen documentaries on it too, in the nursing homes especially.
And I would not disagree with you one iota. It just can't be a replacement. It's not enough to solve the problem, but absolutely it's something we should do. There's waste in all areas of government. When I hear some people say that our problems are that there's too much government in our lives and it's because government is so wasteful. Well, private enterprise is wasteful too. It's just that we're not all contributing directly to the cost of it. Yes, sir.
Yeah, just to dovetail on what you said, is like I get Medicare, and when I get a statement, it's like diagnostic, 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 and it says like, you know, X amount of dollars. I don't have a clue if Medicare paid correctly. And my second career was with Social Security. So I had, you know, some background, and now as a consumer, I can see why there's a lot of fraud going on, because people who have, you know, good intentions can't detect that the system is being ripped off.
Clearly, there's a lot of interest in medical care, and we could spend a long time talking about it. It's an important subject.